On Friday, October 2, 2020, President Donald Trump was transported to Walter Reed National Military Medical Center in Bethesda, Maryland, after testing positive for COVID-19. The White House confirmed the president's diagnosis earlier that day, stating he was experiencing mild symptoms, including a low-grade fever, congestion, and fatigue. The transfer to Walter Reed, a facility equipped with specialized medical staff and resources, was described by officials as a precautionary measure to ensure immediate access to advanced medical care should his condition worsen. This hospitalization occurred just 32 days before the 2020 presidential election, immediately shifting national attention from campaign activities to the health status of the commander-in-chief. The development prompted urgent questions regarding the president's ability to perform his duties and the stability of government operations during a critical period of national and international uncertainty. White House Press Secretary Kayleigh McEnany announced the president's positive test result via Twitter at 12:54 a.m. Eastern Time, confirming that First Lady Melania Trump also tested positive and was experiencing mild symptoms. President Trump departed the White House South Lawn via Marine One at approximately 6:16 p.m. Eastern Time, waving to reporters before boarding the helicopter for the short flight to Walter Reed. His physician, Dr. Sean Conley, stated in a memo released at 6:30 p.m. that the president was receiving an experimental antibody cocktail from Regeneron as a precautionary measure prior to his transfer, alongside zinc, vitamin D, famotidine, melatonin, and a daily aspirin. The decision to hospitalize the president despite initial reports of mild symptoms indicated a heightened level of concern within the administration regarding the potential progression of the viral infection, particularly given his age of 74 and weight. The immediate focus became the president's prognosis and the implications for the upcoming election, with campaign events swiftly canceled. The White House Medical Unit initiated contact tracing protocols immediately following the positive test results. Following his arrival at Walter Reed National Military Medical Center on October 2, 2020, President Trump began a course of treatment that included several medications. Dr. Sean Conley, the president's physician, provided updates from the hospital, detailing the medical interventions. On October 3, Dr. Conley announced that the president had received his first dose of remdesivir, an antiviral drug, on Friday evening. He also confirmed the president was receiving the experimental Regeneron antibody cocktail. During a press conference outside Walter Reed on Saturday, October 3, Dr. Conley stated that the president was doing very well and was fever-free for 24 hours. However, conflicting information emerged when White House Chief of Staff Mark Meadows told reporters shortly after the press conference that the president's condition had been very concerning on Friday and that the next 48 hours would be critical. This discrepancy led to questions about the transparency of the information being released to the public. On Sunday, October 4, Dr. Conley confirmed that the president had experienced 2 episodes of transient drops in oxygen saturation, one on Friday and another on Saturday. He also revealed that the president had been given supplemental oxygen at the White House on Friday before his transfer to Walter Reed. Furthermore, Dr. Conley announced that the president had begun a course of dexamethasone, a steroid typically used in more severe COVID-19 cases, on Saturday. The medical team emphasized that the president was responding well to treatments and was ambulatory within the presidential suite at Walter Reed. The combination of an antiviral, an experimental antibody treatment, and a steroid indicated a comprehensive approach to managing the president's infection, reflecting the seriousness of his condition despite official assurances of mild symptoms. The medical team's briefings became a focal point for national and international news organizations. President Trump's hospitalization for COVID-19 in October 2020 occurred amidst a broader outbreak within the White House and among his close associates, just days before the president's positive test. Several high-profile individuals who had attended a White House Rose Garden event on September 26, 2020, for the nomination of Judge Amy Coney Barrett to the Supreme Court, also tested positive. These individuals included former White House counselor Kellyanne Conway, Republican Senators Mike Lee and Tom Tillis, and former New Jersey Governor Chris Christie, who had assisted with debate preparations. White House Press Secretary Kayleigh McEnany also tested positive shortly after the president's diagnosis. This cluster of infections raised concerns about adherence to public health guidelines within the executive branch and the potential for further spread. The president's illness significantly disrupted his re-election campaign, forcing the cancellation of multiple rallies and campaign events in key swing states, including Florida, Wisconsin, and Pennsylvania. The second presidential debate, scheduled for October 15th, was also affected, ultimately being canceled after the Commission on Presidential Debates announced it would be held virtually, a format President Trump rejected. The president's health crisis also brought renewed attention to the 25th Amendment of the U.S. Constitution, which outlines procedures for presidential disability and succession, while White House officials consistently stated that the president remained fully capable of performing his duties. The discussions underscored the constitutional mechanisms in place for such contingencies. The event highlighted the unique challenges of managing a pandemic while leading a nation and campaigning for re-election, with the president's personal health becoming a central political issue. The transparency of information from the White House medical team and administration officials remained a subject of intense public and media scrutiny throughout his stay. The news of President Trump's COVID-19 diagnosis and subsequent hospitalization elicited immediate and widespread reactions both domestically and internationally. Vice President Mike Pence, who tested negative, assured the public that he was in regular contact with the president and that the administration remained fully operational. Chief of Staff Mark Meadows reiterated that the president was in good spirits and continued to work from the presidential suite at Walter Reed. Messages of support and well wishes poured in from world leaders, including British Prime Minister Boris Johnson, German Chancellor Angela Merkel, and Russian President Vladimir Putin. Domestically, political figures from both sides of the aisle offered their prayers and hopes for a swift recovery, though some Democratic leaders also emphasized the importance of following public health guidelines. The stock market initially reacted with a dip on Friday, October 2nd, reflecting uncertainty, but largely stabilized as more positive updates on the president's condition emerged over the weekend. Public health experts and medical professionals closely monitored the situation, with many expressing concerns about the potential implications of the president's illness for public trust in health recommendations, particularly regarding mask wearing and social distancing. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, commented on the seriousness of the virus, emphasizing that even world leaders are susceptible. The conflicting reports from the White House medical team and other administration officials regarding the president's condition led to a significant public debate about transparency and the public's right to accurate information regarding the health of their leader. This period saw an intense focus on the communication strategies employed by the White House during a health crisis of national significance. The event underscored the global nature of the pandemic and its capacity to impact even the highest levels of government. President Trump was discharged from Walter Reed National Military Medical Center on Monday, October 5, 2020, after 3 days of intensive treatment. Upon his return to the White House, he walked up the South Portico steps, removed his mask, and saluted Marine One, a moment widely broadcast. He then recorded a video message from the White House balcony, stating he felt really good and urged Americans not to be afraid of the virus, emphasizing his personal experience with recovery. Following his discharge, the president continued his recovery at the White House, where he received further medical monitoring and care from the White House Medical Unit. His physician, Dr. Sean Conley, stated on October 8 that the president had completed his course of therapy and could safely resume public engagements on Saturday, October 10, based on CDC guidelines for discontinuing isolation. The president quickly returned to the campaign trail, holding a rally in Sanford, Florida, on October 12, where he declared himself immune to the virus and appeared without a mask. Subsequent medical reports from the White House physician indicated that the president tested negative for COVID-19 on multiple consecutive days following his recovery, confirming his non-infectious status. The White House implemented enhanced COVID-19 testing and contact tracing protocols for staff and visitors in the aftermath of the outbreak, including daily rapid testing for many personnel. The total number of individuals within President Trump's orbit, including staff, advisors, and political allies, who tested positive for COVID-19 in the cluster linked to the late September and early October events, reached at least 34 people. This figure includes senior White House staff, members of Congress, and campaign officials, highlighting the extensive reach of the outbreak within the executive branch and its associated networks, prompting a review of White House event safety protocols. The long-term health effects of his COVID-19 infection were not publicly detailed beyond his immediate recovery.